going to be going over urinary tract infections, who's at risk, how to prevent them, and all of that. So let's jump right in. All right, so what is a urinary tract infection, or UTI as we call it? A urinary tract infection is an infection, a bacterial infection that begins with the urethra, which is the outside portion of the urinary tract where the urine comes out of your body, progresses up into the bladder, and from there it can go to the ureters and then onto each kidney. So anywhere in the progression of the urinary tract can be infected with bacteria, causing a urinary tract infection. The most common cause of a UTI is the bacteria called E. coli, and it lives in the GI tract, in your guts and your intestines and whatnot. So it's common for it to be located right next to your anus after you have a bowel movement. It's common to find it in stool. So leading into my next slide, it is very common for women to get this, to get urinary tract infections, because of how close the proximity is of the anus to the urethra for women. It's very short distance. Also, it's a very short distance from the urethra into the bladder where the urine is stored. So it's not it's more common for women who, especially if they don't wipe properly, if they wipe back to front, for them to pull that E. coli into their urinary tract. Another people who's at risk would be diabetic people, because they have a higher concentration of sugar in their urine, which makes it a great place for bacteria to multiply. In the senior population, they have a decreased immune system. And due to their cognitive decline, they're not as able to take care of their hygiene or notice when their hygiene is lacking, so they become susceptible to urinary tract infections. Elderly people are less likely to notice when they're thirsty, so they don't drink as much water as they should, and so they don't urinate as much as they should, which means that they have urinary stasis, or urine just sitting in the bladder, able to multiply, to sit there and multiply and grow. Another possibility is for men. Even though women are more susceptible, men have the potential of having an enlarged prostate, which makes it hard for them to urinate, which increases the chance of urinary stasis in the bladder. Also, weakened bladder muscles or weakened pelvic floor makes it harder for elderly people to urinate. So once again, urinary stasis. Next slide. Okay, so what causes urinary tract infections? As I stated previously, E. coli is the #1 bacteria that causes it, and it's transferred from the GI tract up into your urethra. But another huge cause for urinary tract infections is catheterization, which we see a lot in elderly people who have a hard time urinating, whether they're being catheterized in the hospitals or they're self-catheterizing at home. If you don't use sterile technique, you wind up with the possibility of introducing that bacteria into the bladder, and from there it can multiply and spread to the kidneys. Also, sexual intercourse. If you're having sexual intercourse, it increases the risk of bacterial infection and the introduction of bacteria into the urethra. So signs and symptoms. The classic signs and symptoms of any urinary tract infection, whether you're a man or woman, is urgency, incontinence, painful burning urination, blood in the urine, fever, cloudy urine, strong smelling or foul smelling urine, pain in the abdomen, the pelvic area, the lower abdomen area, and flank pain on the side or around the back. But when it comes to the elderly population, one of the biggest things that you're going to see, one of the reasons it's so hard to diagnose a urinary tract infection, is because one of the common symptoms they present with to begin with is confusion, disorientation, agitation. If you know an elderly person that's experiencing confusion, it's entirely possible, but it may just be suffering from a UTI. If left untreated, it can spread to the kidneys, in which case it could spread from the kidneys to the bloodstream and cause septicemia, which is a life-threatening event and needs treatment immediately. And I'm going to turn it over to Tia.
So we're going to go over some urine characteristics. Here are some examples of urine, and they may differ. There may or may not be blood present. It can be clear to cloudy, dark yellow to amber. It may be foul smell. Typically, there's white blood cells that are present in the urine, which are leukocytes. So, some Geri considerations present with one thing that they may present with is confusion and delirium, agitation, and lethargy. So, we want to be on the lookout for changes in mentation. They might show these symptoms, they may not. Painful urination, increased frequency or urgency. So our geriatrics tend to have weakened pelvic floor muscles, and we can do Kegel exercises to strengthen those. They naturally have a slowing down of all of the body systems. They typically have a weakened immune system and a weakened bladder, and they tend to hold on to that urine. Some UTI treatment considerations. As soon as you suspect a UTI or have symptoms, you need to follow up with your doctor. Have you provide a clean catch urine specimen. A urinalysis will be performed. That'll tell us if there's blood present or white blood cells. If there are leukocytes present, we'll send it for a culture and sensitivity, and that'll determine what antibiotic that we need to be put on. Um, we can use over-the-counter pain relief like Tylenol, along with a heating pad or cold compresses, as long as it's not contraindicated for diabetes. We want to increase water intake. We may drink cranberry juice. We want to avoid alcohol, caffeine, and citrus. And we want to make sure to finish all antibiotics, even if we're feeling better.
Alrighty, guys. So I'm going to talk a little bit about some prevention. As Adrian said, UTI is more common in women than men. So most of these preventative measures are aimed towards women for that reason. This first one is all inclusive, so we want to make sure to drink plenty of fluids, and that's about 8 glasses a day. It helps dilute your urine, and it also makes you urinate more often, which flushes that bacteria out of your urethra. It doesn't give it a chance to build up. So next, also as mentioned, we want to wipe from front to back to prevent spreading that bacteria from the anus to the urethra. We want to empty the bladder after sex. And we also want to avoid irritating feminine products. That means douches, deodorant sprays, powders. These can irritate the urethra. Probiotics are also a good preventative measure. They help maintain the natural flora of the vagina, and what this does is it helps get rid of and fight off any pathogens or bacteria that can cause a UTI. Cranberry juice is another thought of preventative measure, and many studies show that it can be beneficial. These studies aren't exactly final yet, but there are good evidence that cranberry juice helps prevent UTIs. Next, diet. This is also preventative, although there's not a specific diet for preventing UTIs. It kind of all circulates around staying healthy. So again, we want to drink water. We can drink cranberry juice. There are foods high in vitamin C like oranges, tomatoes, and spinach, and these reduce the acidity in your urine and help prevent UTIs. You want to limit your sugar intake because sugar is a food source for bacteria, and when you have a lot of this in your body, it helps those bacteria grow faster. So limiting this can help limit bacterial growth. Overall, you want to eat a healthy diet and maintain your overall health because this can fight off infections more easily. A typical older adult should have 1.5 to 2 cups of fruit, 5 to 6 ounces of protein, 2 to 2.5 cups of vegetables, 3 cups of dairy, and 5 ounces of grain per day to maintain a healthy weight. You can, however, visit this link. It's myplate.gov/myplateplan. And what this does is it lets you put in your age, your weight, your height, and it lets you know how much of each of these food groups you should be consuming. Next, hygiene is a big preventative measure. UTIs are caused by a buildup of bacteria, and you can pick these bacteria up on your hands from just about any surface or even your own skin. If you touch your genitalia with unwashed hands, you can spread bacteria that cause a UTI. It is especially important to wash your hands when you're sick, before, during, and after food preparation and eating. You want to make sure to wash your hands after cleaning a wound or using the restroom or even helping a child use the restroom. It is also especially important to wash your hands after you blow your nose, cough, sneeze, even after you touch animals or animal food. I'm next just going to go over the proper steps to wash your hands. You want to start out cleaning your hands with running water and applying soap. Then you want to lather those hands together, cleaning in between your fingers, your palms, the backs of your hands, and even under your nails. You want to do this for at least 20 seconds, and a fun little way to remember this is you can sing your ABCs 2 times, and that's about the right amount. Next, you want to rinse your hands in the running water. And once they're rinsed, you don't want to recontaminate those hands. So it's best if you turn the tap off with just another paper towel.
To continue on with preventative measures, always remembering to wipe front to back, keeping it clean, emptying your bladder every 2 hours. If you're incontinent, that keeping that area, your genital area clean will lower the number of bacteria that are present. That's reducing the likelihood for organisms to enter your urethra and your bladder. Some good hygiene practices that you can use at home. Washcloths, you're going to need a warm water basin, whether you're sitting in the tub or just at home, just a side in bed. Nice gentle soap. If you have sensitive skin, you might just want to use nice warm water. If you do use soap, make sure you're rinsing well. You may have to change your water, and it's okay to use more than one washcloth if it gets soiled to use another one. So get as many washcloths as you think you might need. For our gentlemen out there, if you are uncircumcised, you're going to want to pull back the foreskin. Make sure you're wiping from the center of the penis out to the outer rim, getting underneath the folds and down the shaft, under and around the scrotum and the inguinal area. And again, if you need to, use more than one washcloth. For our females, remember, we have lots of folds, lots of crevices. Those are all areas that can be sources of bacteria. It's warm, it's moist, it's dark, it's the perfect place for bacteria to grow. So make sure you're taking the time to wash in between those folds. If you're using a cleansing agent, make sure you're rinsing it off well. Patting dry. For our visitors that are watching today that might have Foley catheters, it's important also to make sure you keep your Foley clean and area around the catheter. A good tip for keeping UTIs at bay is maintaining your drainage bag below your bladder. If you're in a wheelchair, making sure you're hanging it down below on a hook. If you are laying in bed, making sure that your Foley bag stays below your bladder. That can prevent a backup of urine into the Foley tube back into the bladder, causing those infections. Caring for your Foley at home, making sure that as females that you're separating the folds, that you're stabilizing that catheter at the meatus, stabilizing that and wiping around and down away from your urethra. You're pushing the bacteria away further from the source. Again, using clean water, washcloth, warm washcloth, and cleaning around the folds and crevices. Male patients as well, remember, make sure you're stabilizing and wiping from the tip out, using more than one washcloth if you need to. If you're using any type of cleansing agent, making sure that you are rinsing that area well so you're not leaving an irritant that can bother the skin. Make sure you're putting on underbriefs. If you're wearing underwear, cotton garments are the best. They are breathable. They lower the risk for infection because you're getting air moving down in those areas where moisture can build up. If you are someone that's wearing protective briefs, you might wear just the regular brief, but you might feel tempted to add in an insert for extra coverage or extra pad. We would advise against that just because creating more moisture content and it's irritating to the skin. You're not letting the skin breathe. A lot of those pads have elastic and plastic. You need to let air breathe through there. So more often that you can, wear cotton briefs, and don't double up on briefs or add additional inserts into briefs if you're wearing those. And it was already mentioned, but for our seniors out there that are still sexually active, making sure afterwards that you are drinking water after intercourse to flush out that bacteria. And for our female ladies that might be watching, to urinate if you can right after intercourse to can flush the bacteria out.
Alrighty, guys, I'm just going to wrap this up. If you end up having a UTI or suspecting you have one, when you go to the doctor, they are going to make you take a clean catch urine specimen. And I just wanted to explain to you how you do this. So for females, first of all, you want to wash your hands. When you sit on the toilet, you want to spread the labia and you want to wipe your folds first. Next, you are going to want wipe front to back and a second wipe to wipe your urethra. Keeping that labia spread, you want to urinate a small amount into the toilet, stop the stream, and then put the cup in front of your urethra and fill it until it's about half full. Next, you can finish urinating into the toilet bowl. For men, it's basically the same. You want to wash your hands. If you're uncircumcised, retract foreskin and clean the head of the penis with a sterile wipe using a circular motion. You want to urinate a small amount into the toilet, stop that flow of urine, and then fill the sample cup at least halfway. For both males